Yep, I'm at work. It's where I always feel like I am these days. I have just arrived back from Dunedin, having driven back here today, having been to the limb centre this morning. And I'm going to split this into negatives and positives. Let's finish with the positives. So I'm going to start with the bits that are bugging me and getting up my nose. So, as I suspected, this socket is completely wrong and they're going to have to remake it. And that means another 3 trips to Dunedin. And now bear in mind, I'm still arguing about the cost of these. And so this is potentially a cost to me, which is really not sitting well with me, considering I've been up there nearly every week since the beginning of the year. And it's just getting a bit too costly for me personally, the amount of time I'm losing off work and all the arguments and the stress that is connected with that. I'm just sick of driving up and down to Dunedin, to be honest. And I'm sick of having pain in a leg that doesn't work and all that sort of thing. Then that means there's more waiting. So I've got to wait for the new socket to be made. I've got to go back up again. We've got to do the trial socket thing again. Then I've got to wait for another leg to be made, blah, 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 blah. So I'm not entirely amused today. But the thing that's really getting on my nerves the most is the fact that I'm beginning to feel like a second-class citizen. Now, what I mean by that is, I remember saying before in a previous video blog that there's 2 medical systems here in New Zealand. One is the public system and one is ACC, the Accident and Compensation people. Now, if I had an accident and my leg got chopped off, I go into the private medical care system and there's never a problem ever again. But because I'm in the public health system, because it wasn't an accident, well, it was in my opinion, because the doctors made a mistake and we're still arguing about that, but because it wasn't an actual accident like a traumatic injury or anything like that, I go into the public system. And the public system is definitely a second-class system because I'm sick and tired of hearing about the cost of things. So apparently, I can't have the proper skin covering finish. I asked about this today, right? The fact that there's a sock on here and not a skin covering finish, which means there's a sock on the foot, which means I can't wear jandals, flip-flops, because there's now a sock over the foot and there was a gap between the toes. And I was asking about this. Well, apparently they are short on supplies and the only skin that they've got they're using for ACC customers because they're more important. So I asked about the amount of time that it takes, and I asked about the limb sleeves and things like that. Oh, well, we just have to wait because we've got a budget and we're very strict. We're very tight on the budget, and so you're just going to have to wait because we are prioritising ACC customers. And that's what I'm getting all of the time. So everything costs something that is too much, and I have to wait because I'm not as important as the ACC customers. And that is really beginning to piss me off, quite frankly, because I lost my leg, not because I chose to. So I shouldn't be penalised in the healthcare system. And yeah, I'm just really angry about it and I'm tired of hearing about it. So, could I have the socket last week? Well, yeah, but I need to take that nut off the bottom because it's $250. I know you're on a budget and all that, but I don't need it to be smeared in my face every damn day I go up there, just keep it to yourself. Anyway, so I've still got the leg because they're making me a new socket and I get to keep this leg, and it's not exactly ideal, and what they've done is put some adjustments into it, like so. But I have to keep this leg and then I have to wait for them to make the new one. And then we go through the whole trial socket thing again. Now, because they're short of staff, my prosthetist is not there next week. So do you mind if you wait 3 weeks? Yes, actually I do. So I'm getting a new prosthetist and he's going to make the trial socket, make the new leg, blah, blah, blah. So it'll be interesting to see how that whole process differs. Maybe I'll hear less about the bloody cost of stuff, but yeah. So that's where we're at with the leg. I've still got this one to walk around on, but it's not ideal, but they've altered it as much as they can, and I'm just waiting for a new socket to be made. Oh, tough, hard cheese. Some legs are good and some legs are bad. You just got to suck it up and like it, buttercup. It's easy for you to say if you're not an amputee. let's switch to the positives. This morning I went to St. Clair. I nearly didn't. I dragged my sorry ass out there because I had a really early appointment, so it meant I had to be up and out at 6 a.m. But I was blessed with this sunrise. Now, the leg is not perfect. It does still hurt a wee bit to walk on it, but I am using it as much as I can with the crutches and offloading onto the crutches when I need to. And I went to the mall very briefly after my appointment this morning before I got lunch and left. And I walked through the mall for the first time in a long time. Usually I would take the wheelchair. And I managed to walk up steps 1 foot at a time. I didn't manage it going down. I'm not sure why down is harder. So yes, I could go upstairs 1 foot at a time like that, as long as I was holding onto a crutch and holding onto the railings. Down, different. I also managed an escalator, and the escalator down and up. Now you're standing on the edge of an escalator with a foot, a not foot, and crutches. Which foot do you step off with first? I'm not really sure of the answer because I sort of went, oh, and I did the same thing both times. But anyway, I got up and I got down and I didn't fall. So that's great. Then I can say that I've barely used the wheelchair. I always take it with me, but I really only used it around the hotel room. I didn't actually take it out anywhere else. And I probably could have left it in the car. So that was pretty damn good. But the best and the most exciting part is my physio contacted me because he was worried about the length of time that I've been out of physio and the amount of dramas we're having with this here leg and it not being perfect. So we are starting physio back up again at the end of this week, which is quite exciting. So that means I might have to dial back the workload for a wee bit because he's really concerned about the lack of conditioning in an upright position and how I'm like swimming around the world type thing, but not doing very much standing and walking. So we're going to work on that, and that starts on Friday. So yeah, I'm a bit ticked off about the medical system, how it's making me feel a bit inferior and everything's a damn inconvenience and a cost. But there are some positives to look at here, and yes, that's kind of a summary. So I've just got back and I'm just about to start work for the afternoon, evening. Not an ideal situation, but this is the things we have to do when you're trying to fit in work, lots and lots of limb centre appointments in a town that's nowhere near here, and balance all your finances. It's not easy being an amputee.